What would it look like to be informed about how certain types of careers can work with you or against you when becoming a mom one day? That's one of hundreds of topics that will be addressed at this year's Young Women's Leadership Summit. The Young Women's Leadership Summit is the largest all-women conference in the conservative movement, and it's for all ages. It's taking place June 7th through 9th, featuring some of the biggest guests we've had on the spillover in the last year, some people I look up to so much in parenting, conservative politics, crimes against children, and health and wellness that haven't been on the show, and more. Seats are very limited, and you don't know anyone going, you say? Don't have to. I went by myself the first year and made lifelong friends. This is my favorite event Turning Point does, and I know that you have FOMO every year that you don't go. So let's try something new. Join us in celebrating getting back to our roots. June 7th through 9th in San Antonio, Texas. Details and tickets at ywls2024.com. Use code ALEX for 25% off general admission. That's ywls2024.com with code ALEX for 25% off. Find the link in the show notes. Your oral health, your teeth, your gums, all of it is connected to and playing a part in what's going on in your body overall. This week's guest is one of the most recognized leaders in holistic and biological dentistry in America. He understands that the mouth is an integral part of the body and that teeth originate from the same tissues that form your central nervous system. So when a dentist treats the mouth as though it is separate from the rest of the body, it can ultimately lead to compromised health. He'll be answering questions on everything from mouth taping at night to root canals. His practice is located in Portland, Oregon, so you know what that means. Pray for him. Watch this interview by subscribing to Real Alex Clark on YouTube. You may not know this, but The Spillover is produced by Turning Point USA, a 501c3 nonprofit. That means everything that I do, the ability to interview guests in person, have a multi-camera setup, pretty set. Everything is funded by conservatives like you. Actually, the set right now is a little in progress. I probably shouldn't be drawing attention to it, but we need to get like new furniture and good background and all that kind of stuff. So guess what? If these countercultural interviews that are impacting the lives of young families and young women are important to you, you see the value, please consider becoming a financial supporter of The Spillover to make a tax-deductible donation. And so we can finish the wall here because there's nothing on this wall. You can find the link in the show notes. If you can't at this time, that's okay. Leave a 5-star review. That's fantastic. That lets prospective listeners see why the show is valuable and how it has impacted your life in a positive way so that they consider listening. You can visit my guest practice at Blodgett Dental Care in Portland, Oregon, or try to see him on his Toxic Tooth Tour 2024, happening across the country right now. This weekend, he'll be in Nashville, Austin, Chicago, Denver, and Boston, sharing the truth about toxic practices in traditional dentistry like fluoride, root canals, mercury fillings, and more. The link for his website is in the description. Please welcome holistic dentist Dr. Kelly Blodgett to The Spillover. As a holistic dentist, what are the procedures, the ingredients, the practices that are going on in traditional dentistry that are gravely concerning to you?
Let's start off with the most obvious, like mercury fillings. You know, the Mad Hatter syndrome, that we used to talk about 200 years ago, people that would play with, mercury absorbing into your body. We know that it's horribly toxic. Unfortunately, it's still being used in America. Many European countries aren't using it anymore, but mercury in your mouth, not good. It's constantly vaporizing and you inhale it and swallow it.
What are the side effects of it?
It can take time for some people, but mostly it's like neural degeneration. Like you inhale it, goes to your brain, it degrades the neurons in your brain and, can lead to neurodegenerative issues. It also has, an energetic issue. So if you have other metals in your mouth, like gold crowns or titanium implants or metal partial dentures, like you're creating batteries in your mouth, which can totally disrupt the energetics. I mean, think about how close, your mouth is to your brain, and you start shifting the energy that flows through there by adding metals. And so not the healthiest thing to put in your mouth. Second thing in my experience, and I've been doing this 25 years now, is root canals. I was trained to do root canals in dental school, and it probably took me 15 years of extracting root canals to start observing how differently they looked when we extracted the teeth, like how dark and particularly inside where you put the root canal filling, like it'd be black. And I reflected that like it was white and pink stuff when it went in. Where'd the blackness come from? And so started looking more deeply into like why would this occur? And again, going back to energetics, like when you take the nerve and blood flow out of a tooth and put in quote unquote inert materials, what happens to the energy flow that goes through that meridian? And we find that it generally decreases flow. So every organ, tissue that's connected energetically to that tooth is also going to receive less energy than it was when the tooth was healthy. So those are biggies. I do think, as another just having done this a long time, observe that the ways and the rates at which we put metals into people's mouths without critically considering might this human being be sensitive or allergic to any of the components that are in those materials, particularly titanium implants, right? Um, Most, if not all, of titanium alloys have nickel in them, and most men that I meet, they might not know if if they respond poorly to cheap earrings, but most women do.
Oh my gosh,
So
wait, that is
yeah,
a real thing. Getting the cheap jewelry and it irritating you, and then wait, that same material is some of the stuff that they use to fix problems in our teeth?
right,
Wait, that is a huge, like, aha moment for women.
yeah. And it's a bigger, like, kinda smack in the head to men because it's like, what if you're getting this and you don't know? I mean, how would you know ahead
Yeah,
of time, right?
so how does holistic dentistry compare to traditional dentistry?
The simplest way I can say this is that traditional dentistry, the way that I was trained in school, was very symptomatically driven. I see a hole, I drill it, I fill it. Very little consideration was given to why did it show up in the first place, and how might we help the body maintain its own health? The way that I try to approach a biological and holistic approach to dentistry is to look at those root cause issues, to work in tandem with other healthcare providers, naturopaths, acupuncturists, functional nutritionists, people like that, osteopaths, um, to help look at the wholeness of a person's health. Because my belief system is that the human body was designed to be self maintaining in health. But, as you and I both know, I mean, we're exposed to so many things in our life's journey that have toxicity or can degrade our energy. In dentistry, it's not outside of that at all. I mean, it's a huge part of it. The interesting thing is that in my experience, it's the one area of health nobody's looking at. It's like, you go to your physician. I remember years ago, about 15 years ago, I asked a friend who is a fertility specialist. And I'm like, "Okay, so who do you see?" He says, "Well, it's women who either can't get pregnant or they're not able to maintain a pregnancy." And so my question to him was, "Okay, like where in your health history assessment do you ask them, have you had mercury in your mouth? Are you being, exposed to fluoride chronically? Have you had root canals? Have you had titanium metal implants in your mouth? Do you have gum disease?" And none of that. It's like the only question about dentistry was, "Do you have a dentist?" Yes or no. I mean, it's just largely ignored. So, yeah, I think the practice of holistic and biological dentistry is a wonderful thing at its core. The challenge today is that from a marketing perspective, there are hundreds, if not thousands, of dental practices, who are putting on a new hat to say, we're a biological practice, we're a holistic practice. And it begs the question because there's nobody regulating anybody using those terms.
Yeah, how do you know that they're really a holistic dentist?
Right. And what does it mean if they say that they're holistic? And if you called up and asked a practice, they might say, well, we use ozone and a laser. And you're like, okay, that's great. Like, tell me more. Like, well, I don't know. The doctor's really into the laser. And that might be the end of it. So, and in all fairness, I think that most dentists who decide to take this path, I mean, it's a lifelong journey to continue learning and opening your mind and spirit to what people are bringing to you, um, and being extremely humble. I mean, because every week I'm learning from my patients.
Yeah,
Right.
so I was going to ask you, did you go to dental school thinking, "I wanna be a crunchy dentist"?
So I became a dentist because I came to Christ in my senior year of college, and I was just about to start a master's program in psychology. I thought I was gonna be a counselor, that's what I've envisioned myself doing. And then God called me to become a dentist, and what I heard him calling me to do is reverse the negative stereotype and experiences in dentistry. So when I went to dental school, I knew there was a calling on my life to step forward and try to create more positive experiences for people. And I would say in the first 15 years of my career, I was trying to do that through technology, less invasiveness, um, help people understand their own oral health in ways that they couldn't without advanced technologies. And really, it was through the experience, as a clinician for a decade and a half, I started seeing patterns and themes and realized, I need to learn a lot more about the total and whole connections of the body. So that just, started the journey I've been on the last 10 years.
Why is the stigma of holistic dentistry that it's less legit?
I think that if you look at the standards, they're big groups. If we look at, let's take the mercury filling situation. The American Dental Association for decades has been saying there's no scientific evidence that proves that there's any harm for putting this in people's bodies. Interestingly enough, I think it was May of 2020. Remember, people's attention were on other things at the time. The ADA had released a press release saying, "Okay, well, we admit that it is being released, but it's really not too much of a concern unless you're a child 6 or under or a pregnant woman. Other than that, it's safe. We consider it safe." Um, Imagine if we as a society all agreed this is no longer acceptable ways to treat humans to chronically expose them to mercury. I mean, like some of these people, they have mercury in their mouth for 50 years, 60 years, chronically inhaling and swallowing that material. Imagine if we all decided, that's, and there is enough science out there, by the way, that would, in my opinion, make it conclusive that we shouldn't be putting it in people's mouths at all, any part of their body.
Well, I also don't understand. We can look at things and say, this material, this is not good for babies. It's not good for pregnant women. Why would it be okay for anybody else? Like if it's too dangerous for a baby or a pregnant woman, why wouldn't we just say all human beings in general should not be exposed to this material?
Right. I mean, that would be reasonable.
It would be reasonable. It's
Right.
too reasonable. Crunchy living, the truth is they think it's like so crazy. It's like, actually, no, this is the reasonable way to live.
Right. I find it interesting today, like you look at people using glass jars again. I mean, the things that my parents were using 50 years ago when I was a little kid and we had a garden in our own yard, within the Portland city limits, we had a garden and grew our own food. And that was kind of normal in the 60s and 70s. Now it's come back to like, being kind of hip, hipster cool to actually grow your own food and make it be organic and put things in glass instead of a Tupperware, jar or whatever container.
So what's kind of confusing to me
Yep.
is that there's this term holistic dentist,
Yep.
and then there's this term biomimetic dentistry. Am I saying that right?
Yeah, it's another phrase that was developed.
What is the difference? Are they real?
Yep.
What is that? Is one better than the other?
Biomimetic was a phrase that came out maybe 15-ish years ago. Like when academies start coming up and saying like, usually it's a kind of an inspirational leader who says, "Hey, I'm going to start this institute and I'm the guru of biomimetics." I mean, just if you look at the definition of the term, it's mimicry of biological tooth structure, meaning we're going to rebuild this two-layered tooth, enamel and dentin, in two layers that mimic tooth, which is smart. I mean, I've been doing that since I got into practice. Um, I never marketed myself as a biomimetic dentist. Just seems like common sense dentistry to me. But when you consider that the standard is cut a big hole and shove metal in it, I can see why they're trying to differentiate between the process that they're doing, which is perhaps more health promoting.
But why do you need that if we already have holistic? Like if that already exists, holistic dentists, why did they have to create this third term?
Let's say and I know this is getting into a little bit of tooth nuance.
Tooth nuance!
I know, right? People do get excited, you know? It is helpful to understand that the tooth is not like a rock. It's not a piece of wood. It's two distinctly different layers, the enamel, which when you and I talk and smile at each other, we see enamel. And then you have dentin underneath that it's made of more collagen. You've got, tubes through it. You've got little nerve fibers that stick into it. When you cut into those two different structures and try to bond your dental materials, they're very different. You know, one is okay with resin bonding, the other really isn't. So you have to do thoughtful techniques to minimize sensitivity, because last thing people want is, they go in, they have a dental procedure. Now their tooth hurts worse than it did before. So being biomimetic, and again, it's a marketing term as much as it is kind of a term of restorative functionality, for lack of a better way of saying it. Um, we see a lot of people in our practice who go to a holistic dentist to get their mercury out, let's say. Their teeth have never been sore. So they get all their mercury out, and God willing, they did it in a safe way and protected the patient. They put all this composite into their teeth, and their teeth are sensitive now, and they were never sensitive so it's like, well, what happened in that process? Just because you shove a white material or a tooth-colored material into the tooth doesn't mean that it's gonna work out perfectly. So there's some thoughtfulness that I know this is all semantics, but somebody who says, "I'm holistic," but isn't practicing in a biomimetic fashion, may end up with results that are less than desirable.
Okay, so is it better if you're Googling in your city
Yeah.
to go for the dentist that says I'm a biomimetic dentist, or to go with the one that says holistic, or they're both a synonym essentially, and you have to call them and ask them specific things to see which one's legit?
Yeah, I mean, I bang this drum a lot. The best, I'm gonna say this, I try to steer clear of extremes, but in my opinion, the best way to find a dentist who's going to do a great job and with whom you feel comfortable is to pick up the phone and call or email. I mean, sometimes emails work as well. Get to know who you're trusting your health to, because these are permanent decisions. It's not like calling a functional nutritionist and they say, try this for 3 months, and if it doesn't work, we're going to do something else. When you have dental work put in your head, this may be for life. So we want to be able to trust the care, trust the materials, trust the diagnostics, trust the communication. And that requires work.
Yeah.
It's like any relationship. It requires some work.
And there's a special test that a lot of these holistic dentists will offer that'll tell you all of the different dental materials that you are allergic to. And it could cost a couple $100s, but why do you believe that it's worth it?
So the test that we use is called Biocomp. And what I love about it is it directs us towards the materials that are the least reactive for that human being. There's not a single human being that's the same as another. So, and I've helped many people where they had great dentistry done, beautiful dentistry, all ceramic, kind of looks biomimetic. Turns out they're highly reactive to what's in that specific material. So if you know ahead of time what's safe for your body, wouldn't that make so much more sense if you want it to last for life?
Yeah.
I mean, yeah, it's in my opinion, that's well worth the few $100s you might spend. And I will say this, just for the clarifications, it's probably good for 3 to 5 years, primarily because it's not like your genetics change or your immune system changes that much, but the formulation of products changes. And so Biocomp, thankfully, that's part of how they, run their businesses. They do the homework every year to make sure that those materials are the same, and if they've changed, they make those changes in their tests.
You are right about it's not you that's changing, it's the manufacturers, because I think about Teflon. And Teflon, everybody became aware of how poisonous that was. And so they just used different letters. It's just a different term now. And people think it's safe. They're like, it's non-toxic, blah, blah, blah. And so now they don't even realize it's actually Teflon. But so they just change things. They change the names, they remarket things. And so, yeah, I think what you're saying is right, because we just don't know what's going on.
Well, in the dental world, this is going back again maybe 15 years ago, but I remember when BPA was a big thing, like
Yeah.
plastics and BPA. And so what do you think dental companies came out with? We have BPA-free composite now. Well, they just changed the BPA to like BPB now. It's it's
It's the
still
same.
still chemical to which you might be sensitive, but it's a great way for people to hop on board of marketing, bandwagons.
How are our teeth connected to other parts of our body? Tell me about oral and systemic health.
Imagine you're in dental school and you're learning about embryology and looking like, okay, so where does your eye cell and your tooth cell and your toenail cell, like where do these things originate from? And so the teeth originate from the same tissues that ultimately form your central nervous system. So energy flows through every part of our body, every cell, you know? And it's kind of funny how we think we treat people, I should say, as though we're inert, you know? When in fact, like just being in each other's presence, there's an energy that we share because of our electromagnetism. Like that's just scientific fact. But we wonder why it's so uncomfortable to get into somebody's space, to be doing an invasive procedure. And I think about like why I believe God called me to do this. It's like we've been doing this for centuries, ignoring the fact that when we don't have like a loving, trusting relationship between us, how can we then perform care on systems that are integrated to your whole body and just pretend like it's nothing? It's like there's going to be even emotions. Like teeth for people who are emotionally heightened, of course, are going to be more sensitive. I mean, it's interesting. Like for patients in our practice, we'll oftentimes have them use a PEMF unit, like a pulsed electromagnetic field therapy unit, and then some biophotonics, like a red light, infrared light bed, before their treatment.
Hold on a minute. You're doing red light before your treatments?
Red and infrared light
I'm
therapy.
obsessed with you. I have to fly to Portland now.
It's so awesome.
Oh my gosh, I'm obsessed with red light. Like, so that's a whole tangent, but I just think that is one of the greatest, like my favorite health and wellness little things
awesome.
lately. I love it. It helps a lot with me because I have like autoimmune issues and inflammation and joint pain and stuff. So it's really helpful.
Well, all we hear is positive things from patients. They come back over we have like kind of a wellness wing side that we've developed over the years because we see the benefits. And they come back to the dental side and it's like, wow, everything's down regulated. I mean, how nice is that?
When was the last time someone complimented you on your skin? If it's been a while, maybe it's time to switch things up. Mimi Skincare is a conservative and Christian-owned luxury modern skincare brand using proven ingredients that work, like pure vitamin C, hyaluronic acid, retinol, and peptides. You can try individual products for all skin types on nimiskincare.com or get an expertly crafted skincare routine by taking their skin quiz on their website. Are you oily, dry, or combination? You don't know? Nimi can help you find out. I have extremely dry skin, so the 3-step anti-aging routine has been my personal favorite. Support a brand that supports you as a conservative. Go to nimiskincare.com and use code AlexClark for 10% off. That's nimiskincare.com with code AlexClark for 10% off. Find the link and the code in the show notes. What are some small warning signs in your mouth, like little grooves or sores or things that somebody could just feel around or look in the mirror and see right now that would tell them you might have certain vitamin deficiencies or there's certain problems with other organs in your body based on your mouth?
Sure. I mean, the list is so long. Let's say we're looking at teeth and there's a considerable amount of wear and the person's 35. Let's say they've lost they've worn through their own enamel. I think of like if let's say God gave you 100,000-mile tire, supposed to last you forever, in your mouth, and you burn through it in your first 35 years or, maybe 30 years of adult life. It's like, okay, what's going on there? Is it you just enjoy grinding your teeth? I mean, maybe that would be on the list. Seems kind of silly, but is it that you're sucking on acidic things all day long while you're staring at your computer and typing away and under stress? Is it that you have chronic parasitic infection in your gut? I mean, there'd be a list. And this would be where, we as holistic, or do you want to call it biological, or do you want to call it functional, integrative, or whatever the word is you're using, right? Someone who cares enough to reach out to another healthcare provider where we start connecting with their health team to find out, tell me about what you're seeing. Have you done stool sampling? What are you finding that's going on in their gut? What might be impacting their reason for which they are clenching and grinding?
It's like you're a tooth detective.
Yes. Yeah. Most of our new patients say like, this is like Sherlock Holmes stuff. And it's like, yes, this is how we get to the bottom of it, And it's great because then once we remove roadblocks that have been presented for that person's energy and healthfulness, then the body becomes, healthy on its own and self-maintaining.
Right. Okay, so what are some other sores or visual things that you might see that might say you have something wrong somewhere else?
Sure. And the tongue can be a really good indicator depending on, like, let's say you had redness at the tip of your tongue, different from the rest of the mouth. So when we're doing our photographs of new patients, that might be one of the photographs we would take is like, go ahead and stick out your tongue. We're going to take a photo of your tongue. So we can objectively look and they go, huh, isn't that interesting? Or maybe they've got massive scalloping on the side of their tongues because, maybe there's an airway issue. Maybe they had orthodontics to squish their arch together. But let's say the red tip of the tongue, I would ask some questions like, tell me about, what's gone on with your heart. And they might say, well, my heart's fine. Say, oh, okay, well, tell me about, like, did you ever have wisdom teeth extracted? Oh yeah, I had these wisdom teeth out. I was probably like, 19, and how was the recovery? Well, I had 2 dry sockets on the lowers, it was pretty bad. They put me on antibiotics, blah, blah, blah. And we start thinking like, is it possible that those sites where your wisdom teeth were that are connected to your heart meridian, that would also show up on the tip of your tongue, right? It's all reflective of the same system, that tip of the tongue would be giving us a clue about what other questions to ask about your health. That makes sense?
Yeah.
Yep. Or, you see like the sides of people's cheek where they're biting on them all the time.
Oh, I
And
do see that. What's up with
Mhm.
that?
It could be a number of things, This is when we pull out our list and start asking questions.
Okay, well, speaking of asking questions, so I have loved my dentist, gone to a traditional dentist for years and years, and they're amazing and they're great, and I would recommend them. But just because I'm like in this crunchy journey, I've been wanting to switch all of my doctors to being holistic. Like I got a holistic eye doctor and all
Yeah.
this. So I go to this holistic dentist and everything seemed fine to me because I don't know any better. And I'm just like, she says she's holistic. Okay. And then she offers me Botox.
Yeah.
Is that normal for a holistic dentist to offer Botox?
For my practice, that would not be something I would bring in. I do understand that dentists are doing it as an additional revenue stream, or they're doing it to decrease clenching, or whatever reason that they're using to legitimize putting botulinum toxin in people's bodies. Um, Personally and professionally, like, I don't feel that's consistent with a holistic mindset.
That's what I'm worried about because I'm not anti-Botox.
Yeah.
My mind is open.
Yep.
Maybe I will be in a few months. But right now, I'm not anti-Botox, but I'm
Yeah.
anti-Botox coming from my holistic dentist.
Yeah.
So that was weird. Okay, I'm glad to know that I feel reassured that my gut instinct was telling me I need to find a different holistic dentist.
Yeah, and I think you make a great point because it's like, is it within their rights to offer that? Absolutely, and if they can get training and they love doing it and there's good reason for them to do it, great. I don't think that's I think when you start mixing these terms, and that's why it's so challenging to say like, well, we're holistic, but then they're offering you things. It'd be like you go in and they say we're a holistic practice, and they've cleaned your teeth and they've made, maybe there's some patchouli oil in this corner or whatever. I mean, I'm being funny, but like, what if they then say, okay, so we're Alex, we're now getting your fluoride trays ready for you.
That's the thing. It would be the same to me. The way I felt them offering me Botox would be like walking into a holistic doctor's office and them saying, by the way, can we offer you a Coca-Cola? That's to me, I'm like, wait a minute. That doesn't make
Yeah.
sense in this environment.
Yeah.
Twice a year, I'll have my Dr. Pepper.
Sure.
But like, I don't want that coming from my holistic dentist.
Right.
Could an unknown tooth infection actually be preventing someone from losing weight?
Oh, absolutely. Yeah, absolutely. So if you think about chronic infection, imagine you have, I mean, just we'll use a silly example, but it would make perfect sense. If you had a massive infection, the whole palm of your hand was bleeding and oozing pus. This is absolutely disgusting, of course, but like that's what was happening. And you're like, no, it's been this way for 3 years. It's fine. I mean, I just kind of wash it off and wear a glove, put some gauze in there. It's fine. And you went to talk to a health savvy physician. They're like, wait, and you're here for weight loss? Like you're in a state of chronic inflammation. Your whole body is aware that that's going on. Okay. Now, this is very obvious. The problem with root canals is that we take out the nerve, we take out the blood supply, we drill it and fill it. The entirety of the root that's all made of dentin, as I mentioned before, it's porous like a sponge. The pores are 10 to 20 times wider. The diameter is wider than the microbes that live in that environment under the gums. So it's like they have no problem, filling up the tooth, which is where all the black stuff comes from. I started sending these roots out about 8 years ago to a lab in Denver that does DNA diagnostics to help us see what's in there. It's shocking, bacteria, viruses, parasites, you know.
Ew.
I know. And and by looking at the root too, you can't, because many people who come to see me, they've read my stuff and they remember the spooky looking teeth, of course. Like, oh my gosh, did it look horrible? I'm like, yeah, I mean, it looked a little bit dark, but it didn't look spooky. But let's send it in and find out what's been living in there because my eyes don't see microbes.
And so you're saying if your body is focused on that infection that you are not even aware is there, it's not going to cooperate in losing weight or doing these other things that you need it to do?
Literally, those microbes are entering your bloodstream from those dead teeth into your lymphatic drainage system, which goes right back into your venous blood supply and circulates. So how are you going to, get away from chronic inflammation when what's in your mouth when you have root canals is letting microbes come in 24/7?
I'm thinking about all of the people that try to write off all of this like non-toxic living, whatever. And I'm listening to what you say and I'm like, when was the last time that you had any doctor explain things like that to you? How can you say that this stuff is a gimmick or that it's not worth your time or it's not worth it? It's not worth the money. No one else is willing to share that information. That could really change your life.
Yeah. When I started my toxic tooth tour 4 weeks ago in Miami, we had a root canal specialist come. Her friends who were nutritional therapists were like, "You gotta come to this. I think you'd really like it." And I was like, "Wow." I mean, that's amazing. I've never had a root canal specialist come to one of my talks before, and, I've gotta say it was such a wonderful connection, and her eyes got opened to at least thinking about. I mean, she and I just talked this week on the phone. I said, "Here's my cell phone. You call me if you ever have questions, just reach out to me. I'd be happy to mentor or guide or whatever, just offer whatever I can to help you find what makes you most happy in the profession." And she's been having a real, you know, test of faith, so to speak, about going straight from dental school into root canal specialty and never really questioning what are the health ramifications? She understands very clearly what the health benefits of a root canal are. You get to keep the tooth, you can chew on it, it looks nice. Those are real benefits, absolutely. But at what cost? And I mean, I present a lot of cases when I'm or people's stories, I should say, when I'm doing my toxic tooth tour, and it really woke her up. And I'm so glad, right? Because now at least she's thinking, like, okay, what's this mean for me and my profession? And
Well, that's the thing. I think there's a lot of hygienists, dentists, I mean, just people in the dental industry who have been in traditional dentistry and they do have some kind of moral issues with some of the stuff going on and they're considering leaving. What is your advice for people that are currently working in dentistry that feel this pull like maybe I should leave and switch to more holistic dentistry?
yeah. Uh, I encourage them to reach out to me so I can teach them how to run a practice like I have learned through the School of Hard Knocks for 25 years what it takes to build a practice that first and foremost starts with a connection of human being to human being. Like our Mondays now, and for the past almost 4 years, all we do on Mondays is meet new people. That's it. We don't do any dentistry. We don't pick up lasers, drills, anything like this. We might use the red light therapy bed, but no dentistry. It's one-on-one connection. Each person gets 2, maybe 2.5 hours of time.
That's another thing. When you talk about the differences between traditional dentistry and holistic dentistry, 2.5 hours to meet with your dentist and go over everything that's been going on with you,
Yeah.
to do that detective work,
Yeah.
that's not happening in your regular dentist appointment, your regular doctor's appointment. Your wellness checkups are 10 minutes.
Yeah. Well, and, healthcare providers, and I would say that medicine somewhere along the line, just got, I They got off path. It's like, we're no longer listening to people. It's all about numbers and what pills can we prescribe you. You know what I mean? Like, it's just, and dentistry is kind of the same way. If we think that in 90 seconds, when the dentist comes in, oh, hi, Alex. I'm Dr. Blodgett. Good to meet you. And go ahead and open your mouth there. We've never met, by the way. How weird is that? Just, go ahead and just open your mouth and you do it, because you're like, okay, I don't want to avoid conflict here. And you do it. And they're like, oh, yep, you need 4 fillings and a crown. And you can schedule that next Tuesday.
And then they wheel out on your little chair. And then you escape into the abyss of the office on that little wheeled chair.
Yes. The expert has spoken. What are you, like, who are you to question, let alone even understand?
So what about hygienists? I mean, what are they supposed to do? Just say, I'm putting my 2 weeks in and then apply to a holistic dentist office? Or how does that work?
The most effective onboardings that I have had with dental hygienists that we hire are those who came straight out of school and they don't know anything.
Yeah, because it's easier to shape them to be doing things the correct way than reversing what they've already learned.
In the deepest sense of humility that we can, like, we understand there's not a whole lot we know about you. I'm going to learn more and more by asking. The idea that, like, well, my job is to teach you and tell you, that really doesn't hold water. I mean, that might be true for a few of the patients you see, you know, but most people have been struggling with trying to say something or share an experience or and we don't listen. We
Yeah.
don't take the time to ask questions. So it's a massive part of our practice. I mean, every single morning, believe this or not, we sit down and go over emails and phone calls and we review them and we talk as a group about, do we feel like the energy of how were responding or considering responding to this email? How's the energy feel? Is there a more effective way or a more efficient way we could ask or state or what have you? So, and this is why when I think back 30 years, like, why did God have me go through 4 years of, working on a crisis line, working in high schools, working on communications with other human beings? It's to appreciate that communication is massive, whether it's providing healthcare, working, living with your spouse or raising children or whatever, I mean, communication is a huge skill that isn't required to become a doctor or a dentist.
Do dentists ever tell you that you need a filling when you really don't?
In my experience, yes. So about a year ago, when we went from having an associate dentist and me and 4 hygienists, we went down to just me and pretty much 1 hygienist and another part-time. So our capacity to provide the same cleaning and hygiene services changed massively. The point of me sharing this is that all those people who used to come to us for their recare services had to go somewhere else. So in the past year-ish, we have received a number of phone calls from patients, and I'm thinking of one young lady in particular. I started seeing her at the age of 12. She's now 23. So I've pretty much seen her since she got all of her permanent teeth until a year ago. She went to dentist X, who said, you need, like, I don't remember, it was 8 or 10 fillings.
Whoa.
Unbelievable. And so I asked her, like, well, did they share why? And she, they didn't really, they like to, your joking point, they kind of wheeled out, right? We need 8 fillings and, see ya. They got out of there. So I said, have her come in. We'll take a look. I mean, she's been a great patient for 10 years. That we can do her this solid of taking a look. Let's get the copy of the x-rays that they just took. And let's compare them to the x-rays we had from 10 years ago when she was 13. Just for fun. Well, lo and behold, these areas of quote unquote darkness that they were using to legitimize drilling and filling her teeth have been there for the entire time she's had her adult teeth.
Oh my gosh.
Yeah. Because she, as a 10-year-old, 11-year-old, when her home care habits weren't so great, when she was in orthodontic treatment, she developed some loss of mineral. The body then healed it. I mean, that's what the body's designed to do. Body healed that, remineralized those teeth, and we've been observing it for years. It's all fine. Nothing has changed. So on first glance, I actually just saw a woman yesterday. Her husband was like, why didn't you just go see Dr. Blodgett in the first place? But she went to a new practice as well. Oh, you need 4 fillings. And she's like, okay. And of course, and it was so interesting. It's so fresh in my mind because she just told me this yesterday. They even told me, like, with your insurance, it'll only be $40. And so she's like, wow, I mean, how nice. It doesn't cost me
That would be
anything.
me, 100%.
Yeah, like, oh my gosh, it's cheap and you can do it right now. Great. What saddened her is then I pulled up the DSLR photos we had taken, like high resolution photos that we took 4 years ago of her teeth. I'm like, okay, do you remember, like, this is what they looked like? And yes, there was some stain in the groove of your tooth, which is natural, right? It's like having a wrinkle from smiling too much. We're like, we need to resect that. That wrinkle is getting in the way of your living. And it's only gonna be $40. I mean, it's insane. But literally they cut her tooth wide open, put a filling in there, and unfortunately, then her bite's high, the tooth is sensitive. I'm like, geez, all for something that, based on my experience of observing her for 4 years, was completely unnecessary.
Okay, but why would they push for her to have an unnecessary filling if it's only $40? How much are they actually making off that filling?
Probably, I mean, I'm just guessing, right? Let's say it's $300 a tooth and they're doing 2 of them because they're right next to each other. So in maybe 30 minutes, they're producing $600, let's say. I mean, I'm just making up numbers.
So it's like the C-section epidemic of everybody getting C-sections because it's quick money. We have dentists who are just giving out fillings like crazy because it's quick, easy money.
Had I not taken the photos when I first met her, how would I know what it ever looked like? And this is the disservice that I think is happening to so many people, because if you don't we, as providers, if we're not providing you evidence that this is what we see so that you can understand what it is that we're talking about, how are we to trust that what they're saying is truthful?
Yeah.
I mean, wouldn't it be nice if we could just trust everybody and we're all on the up and up? But unfortunately, I mean, I see this all too often where, um, in my opinion, there's a lot of inappropriate care. I mean, we don't ask the question, like, first, tell me what's going on in your diet. For how long have you observed those stains in your teeth? I mean, is it possible that you have old X-rays from your old dentist? They don't, nobody asks for that stuff. So it's just like, oh, I see what it looks like today. Time to drill and fill.
Do we actually need to get cleanings every 6 months?
For a lot of people, no.
Everything in my life is a lie. Let me just tell you that.
Yeah.
I went from every 6 months, diligent my entire life since I was a kid. My parents have been very good about that. Every 6 months. Then I was told recently, you got to speed it up. You got to come every 3. So I'm coming every 3. And finally, even though I come every 3 months, out of nowhere, they tell me I've got to do a whole deep clean, $2,000 deep clean situation because I've got all this gum inflammation or whatever. And I'll tell you in a little bit about more on that and get your opinion. But I'm just like, I don't know what is real.
Yeah. Well, and are there people for whom that's appropriate? Like, absolutely. It's kind of like somebody who has heart disease. The person who's out there and, 42 years old, they eat a very healthful diet, they exercise well, do they need the same prescription of cardiovascular management as the person who smokes 2 packs a day?
Right. And that's what I didn't understand. I didn't understand. You see me every 3 months. How is all of a sudden I need a deep clean? How did we not see this coming? Or how did we not curb this before? Like, that was weird to me. Why do some people who eat hardly any sugar keep getting cavities?
Stress would be one of the first things I would ask about. The old idea of, like, when I was a kid that, if you're drinking, a bunch of Dr. Peppers or whatever, that notion that, like, it's a soda mouth thing, it doesn't hold as much water today. It can, certainly. I mean, if somebody's drinking Mountain Dew, let's say, I'm not picking on Mountain Dew, just, it's an option. If they're drinking that all day long, your teeth are gonna melt. The sugar is not gonna play well with the microbes in your mouth. They're gonna have a party and make a lot of acid. And the beverage by itself is acidic. I mean, look at what they use as a preservative. You've got phosphoric acid in the soda. So think about all of the other things that are either sugary and or acidic these days that are very hip and cool. I mean, have you gone by a Starbucks lately that didn't have a line? Well, just think about their 4-pump Frappuccino that people are sipping on for 3 to 4 hours, and it's my quote unquote, it's my coffee.
I'm also thinking all of the ultra processed food, doesn't that turn to sugar on our teeth?
Absolutely.
Because people think it's a cracker, it's not sugar,
No,
that's not causing my cavities.
Refined carbohydrates. And this goes back over 100 years to Weston Price's work, looking at, like, The diets of native cultures that weren't eating refined products generally had straight teeth, big jaws, open airways, and no decay or gum disease. Like, wouldn't that be nice? But we want convenience. We want to be on our phone sipping our kombucha all day. You know what I mean?
Do
Like,
you see a goldfish cracker epidemic of cavities with kids?
just saw it on the plane today coming to Phoenix.
Goldfish teeth?
Goldfish in hand. And it's interesting because I was in particular watching the behavior of the probably 4-year-old, 3-year-old eating multicolored crackers. I'm like, ooh, I wonder what those dyes are doing. But as it relates to oral health, so you take the crackery stuff or the squeezy tube stuff.
Like the squeezed applesauce?
Right.
Wait, that's bad?
Well, just think about it. Sugar, and it's got a lid. It's not like I think back to when I was in high school in the 80s. If you cracked open a can of Coke, it was a can. You couldn't put a lid on it. So you'd share it with your friends and be like, who can help me finish this up? Because I'm going back to class. You can't take it with you. Nowadays, everything's a screw top. So you take a, hit of your whatever, your sugary stuff, and you're like, great. And you put a lid on it, 15, 20 minutes later, go again. And people do that. And it's, kombucha is one of the ones I've seen it just seems to be trendy these days. And again, I'm not saying anything against kombucha. I personally like the flavor. But if you're putting something that is already acidic and has sugar in it, and you're rinsing your mouth with that, I mean, it takes about a half an hour for your saliva to bring your mouth out of the acid pool. So imagine if you keep sipping every 15 minutes for 2 hours, 3 hours, however long it might be, you know, like you're never out of the acid pool. The teeth are going to lose that battle. I mean, there's no fancy toothpaste. There's no nanohydroxyapatite that's going to, beat out numerous hours of harmful exposure.
What is the truth about fluoride? Is it a neurotoxin? Is it rotting our brains? Because these are the things I'm hearing, and I try to Google it, and it's like no one is telling the truth, it seems.
Yeah. So I've leaned into PubMed for that. When I put in fluoride, IQ, the list of studies goes on and on and on about the decreasing of brain function by measuring IQ of children, typically. I mean, that's typically who the studies are done on, from the exposure to fluoride. Now, in all fairness, I believe in fairness. If you expose tooth enamel to fluoride and it bonds to an enamel surface, it absolutely will make the enamel more acid resistant. And that's been the platform for fluoridation, like since the 50s or whatever. Well, look at that. It's going to make your teeth fight against acid. Isn't that great? Which really just means like now you can eat a riskier diet and get away with it longer. But there's no way you can put fluoride on a tooth without your cheeks, tongue, all these moist mucosal surfaces rubbing up against it. You think about fluoride varnishes these days, which is all the rage in the dental offices because it's faster. You get the person out of the chair faster, so you can see another person per day. It's more production. You put that varnish on the tooth, let it dry up. As they're going home, I mean, their wet cheek is rubbing up against it, and you're absorbing, like, oftentimes, like 5,000 parts per million of fluoride. It's a ton.
And what does fluoride do to the body that's not good?
A couple of things based on my understanding. Both, like, neurologically, it degrades nerve functioning. It also has a negative impact on bone health. So people who have, like I think of people who, let's say, lived in Colorado in an area where it was naturally very highly occurring in fluoride in the water. We would see it in the teeth. So fluorosis, big white, sometimes even brown patches on teeth just due to too much fluoride when your teeth were developing, and also, creates brittle bone issues. So you think about like how many millennia did human beings live on the planet without fluoridated water or, fluoride in your toothpaste and managed, again, you go back to Weston Price's work, that stuff wasn't in the system and people still had healthy teeth, wide arches, big airways, and didn't have decay.
What about, I cannot say these words, nanohydroxyapatite.
Good job.
Did I say it?
You're right in the ballpark. Good job.
Allegedly, that's like a good alternative to fluoride, or no?
You're asking me at the right time. I was just at a talk about a month ago about this exact thing with one of the world's leading experts. Nanohydroxyapatite, it comes in different forms. So a lot of people are putting it in products and getting the cheap version where it takes a very specific particle size to help aid the body and really the saliva, your natural occurring remineralizer, since we're using big words. So what we're doing is using nanohydroxyapatite to try to encourage remineralization of teeth. And that will only occur to maybe 1/4 of a millimeter depth into enamel, and that's that.
And this is supposed to be the safer alternative to fluoride, or what?
Yes. Yeah, I mean, generally speaking.
Is it?
It is safer. Yes, I would say it's definitely safer. You're not going to have, that we understand now anyway, the same absorptive issues that you would have neurologically with fluoride.
Okay.
So it's a hot topic. I think, 10 years from now, I mean, I've been doing it long enough to see trends come and go. It's a hot buzzword right now. Will it still be as hot of a topic, in 10 years? We'll see.
What are your favorite non-fluoride toothpastes? I'm using Dr. Jen's. Do you like or no?
I have not tried Dr. Jen's.
Okay.
So, one I'll have to try. My personal favorite. I can only share my personal favorite because I've tried a lot. There are a lot I don't care for from the taste standpoint, but that's just me. I like the Jason brand Power Smile. When I scan it with my phone using my environmental working group, healthy living app, or whatever they're calling it now, it tests very safe. So that's what I suggest to people when they ask me, like, well, what do you think about this? What do you think about that? Please pull out your phone, download this app, and scan it and see what the safety level is. What's the environmental working group determined their safety level to be on the product first. And then if it's safe, great. Boca toothpaste.
Wait a minute. You like or don't like Boca?
I like the science of it. I like that people like it. I personally don't use it because I don't like the taste.
Because I've heard conflicting things. I've heard that it's not that great of a toothpaste.
I'm the wrong guy to say this, I will admit, but I do have a wife and 2 daughters, and I work with almost all women. It'd be like trying to say, like, well, what's the best shampoo and conditioner? And it would be like, where are you going to go with that?
Now I understand what you mean.
I mean, believe me, when my wife and daughters, when they start talking about this stuff, I'm like, I really,
Okay.
It escapes me.
So Jason, you like the Jason?
I like it, but I grew up on Crest that was minty and refreshing, and I have this association with clean.
What about tooth powder? Is that a scam?
No, I think there's some tooth powders out there that are actually very helpful. I judge this a lot by what people tell me they're doing and how, we ask a lot of questions, as we've talked about. Like even oil pulling, coconut oil pulling. I've seen many people where I'm like, wow, whatever you're doing, keep doing it. Your mouth looks amazing. If what you're doing works, it works. There's no perfect way to do it. There's no dogmatic way it's going to help everybody.
Is coconut the only oil you should be pulling with, or is there any other options?
I've heard of some folks using sesame, but most of the people that I have met use coconut.
Okay.
And if you want to try it, make sure you spit it in the garbage can, not in your sink.
Why?
It will harden. Think about you running cold water down there and it solidifies, becomes like hard oil once it goes down your pipes. And if you do
it's
enough
like bacon grease?
Well, yeah, like coconut oil, most coconut oils are hard. So you take a little spoonful of the hardened oil and put it in your mouth, and as your mouth warms it up, becomes liquid.
Oh my
swish,
gosh.
Swish, swish.
Plumbers across America love you.
Yeah.
You should put on your website, #1 dentist for plumbers.
Yeah.
I never would have thought of that. So thank God you said that. Why are all of these pediatricians telling moms you need to stop breastfeeding because your kid's going to get cavities?
I'm not a pediatrician. I don't know. I mean, I would say from a biofunctional standpoint, like babies come out of the womb. Number one, they're, ideally they're going to go through the birth canal. I know that's maybe contrary to a lot of people's birthing experiences.
We've had Dr. Stuart Fishbein on the show to explain this. we should be able to acknowledge that there is a more ideal way, but it doesn't mean that you're less of a mother.
Right. Absolutely. There's a biological function to it.
Right.
So similarly, like the act of breastfeeding, and I think Stephen Lynn's book, The Dental Diet, he reviews Weston Price's work on this so beautifully and succinctly. So it's not like, a 1,000-page read. Just looking at what happens when a baby's mouth is on a mother's breast, the position of the tongue, the ability to breathe through their nose, the way that they're training patterns that will then become helpful to their health throughout their life happen at birth.
Are these mothers being told this because they're breastfeeding like toddlers? Like it's like they have teeth coming in or breastfeeding, and they're saying this. If these little kids are getting cavities, they're saying it is the breastfeeding. I mean, is that accurate?
Well, what I have seen, and I haven't seen children in my practice for the most part, in 25 years, right? But when I was first in practice, I shared space with a pediatric dentist, and I did see a lot of patterns in his practice as well. What I observed, and also through listening to him, is that babies and young children who have open access to breastfeed at any and all times, and particularly through the night. So like they nurse, as they're getting teeth, let's say, the sugars from the breast milk are in the mouth, and then 30 minutes later, then they might become awakened and they soothe themselves by nursing. I have seen situations where that chronic exposure and there's no letting up, can lead to tooth decay. But in all things, I mean, there would be a balance. I mean, it's interesting too, because you look at, and I'm here to make no judgments about how long mothers breastfeed. There's a lot of different, schools of thought on that. But I think it's a risk factor to consider that when teeth start coming in, those will be impacted by, chronic exposure to sugars and or acids.
So then what should you be doing? Something special on their teeth if you're going to continue breastfeeding once they're older like that?
What I found helpful, I mean, again, we've had 2 children of our own, helping them see the benefits to, oral health, like brushing your teeth, make it fun, like practice cleaning your teeth before your 1-year-old goes to bed. It's really helpful. I mean, I remember both my daughters went through phases where it was like, no, like they didn't want to brush their teeth. It's like, well, there's different ways we can go about this, but helping them see the benefits, and then they make it a life practice, and hopefully, they become adults whose bites work, who don't have any gum issues, like, no gum disease and no decay, and they're in health. Like, what a concept, that we're not chronically managing a disease of any sort. We're actually the way God intended us to be, which is living in health.
Yeah.
And that's possible.
The Rolls-Royce of organic prebiotic body care just dropped a brand new product. You know that I love Alevia's body wash. Absolutely the best non-toxic body wash out there. Hands down, I am stoked to try their anti-inflammatory organic rose water Luxe Mist. Filtered rose water, rose essential oil, Acadian sea kelp. That's it. And it has 10 times the prebiotic concentration that Alevia's prebiotic body wash has to strengthen and multiply the skin's microbiome. That means accelerated skin repair and healing for scars, psoriasis, eczema, or any other skin issues. Love this brand as a gift for moms who just had a C-section because of how gentle and safe it is for her and baby. The fact that it helps speed up the healing and scarring. Go to Alevia.com. Use code ALEX15 for 15% off. That's Alevia.com with code ALEX15 for 15% off. This is skin food. Find the link in the description. What is wrong with the most popular mouthwash brands?
Oh, man. Where do you want to start? First of all, nobody needs mouthwash.
Wait, we don't need mouthwash?
No. Think about, like, again, millennia of human existence. No Walgreens or
yeah, but then people are going to be like, well, they had stinky breath.
We might make that assumption. Maybe they didn't. Maybe they weren't eating fermentable carbohydrates and having stink breath. Who knows? It's such an interesting experience for me when I walk down the oral health aisle at like a Walgreens or a Target, and it's just like rows upon rows upon rows of brightly colored liquids that are made to taste, minty. I even see it in like some dental training facilities. one of which is here in Phoenix area, where it's like, come get your pump of, freshening breath stuff. And it's like, oh, you know, I mean, what's interesting is your breath will be fresh on that stuff for about 5 minutes, 10 minutes. Smell that breath in an hour. It won't be fresh, you know? The alcohol is very disruptive to the oral microbiome. There's a balance, and when you not only ingest alcohol, but intentionally swish it around in your mouth, that's a disruption that you're causing. Reading the ingredients on that stuff is a hoot. I mean, just look at the names of the product. And heck, scan the barcode with your, Healthy Living app. See what it says about its toxicity. But nobody needs that stuff. That's my opinion.
Does everyone really need to get their wisdom teeth removed?
Ooh, no.
I had so many problems with my wisdom teeth removal. Major infection. And you have to sign that thing that says if anything goes wrong, you can't come after us. So
Yeah.
I have no feeling, or it's like really numb feeling in this like left corner of my mouth.
Yeah.
It's really dull. I mean, I can feel myself tapping on my face, but it's very dull compared to the rest of the sensation.
When is it you want to come to Portland?
I know. But I mean, this is jacked up. Like, I'm never going to get that fixed, right? I just live with this?
Not necessarily.
Really?
I mean, yeah, biophotonics, ozone,
Oh my gosh.
Yeah. There's some possibilities for nerve regeneration that aren't surgical.
You're saying not everybody needs their wisdom teeth taken out. How?
So think about if somebody's jaw size is such that the teeth come in on their own, like every other adult tooth that you had. If they come in on their own and they're in a functional bite relationship, like why would we take those out? It makes no sense.
But most people do need it.
I wouldn't say most. I'd say there's a good percentage of the population, and not because of the tooth itself, but because of their orientation. So, like, let's say, for instance, your wisdom tooth isn't coming in straight. It actually, who knows why, it's turned 90 degrees on its side, and it's literally growing into the back of your second molar. But there's a gap between your gums and the second molar where microbes are getting in and around that wisdom tooth. It's an area of chronic infection you can't even access with a toothbrush, floss, water pick. You cannot clean it, right? So in those instances, it's riskier to keep the tooth. You want to get that out, let the bone heal well, you know?
Is there a better age than others to get your wisdom teeth removed?
I would say probably in your maybe early 20s. It would depend though. There's a wide variety there. So like for my daughters, I just watched them come in, and for the older one, I was like, just let them come in. And they came in sideways. But they came in and it was easy to remove them. So I didn't think like, well, you're 16, we better go diving in there. Sometimes you just let things ride. Um, there are instances where like maybe a 15-year-old where you can see that those teeth are going like literally sideways. You can see this on a three-dimensional cone beam CT scan. It's like, well, before the whole root forms, it might be safer so that you don't end up with nerve trauma like you experienced. So you really want to judge that from person to person.
I just don't
we're different.
understand. If I have nerve trauma, which is exactly what I think it is, I think it's like nerve damage.
Yeah.
How would that be potentially fixed?
So we've done over the last year, a little more than a year now, we've been doing a study using what's called neural therapy. So we're injecting procaine, we're injecting ozone, and we're injecting sodium ascorbate, vitamin C adjacent to the bone, not in the bone. And we're seeing for some people, not all, for some people who had chronic bone issues called cavitations, that's how they're popularly referred to, as these areas where they had wisdom teeth out. The bone did not heal well. They had dry socket or whatever. Um, some people's bone, by increasing the energetics of that space, the body gets turned on to start healing itself. We measure that using what's called acupuncture meridian assessment, or you could use muscle testing. Like there's different ways of measuring the energetic flow along those meridians to determine and track the rate of healing.
How does a holistic dentist optimize healing after an extraction compared to a traditional dentist?
God, my favorite question. This was actually my project. How did you know?
I don't know.
When I was at the American College of Integrative Medicine and Dentistry, this is what I did my final project on. So one of the most important things is remove when you're taking out infection. And again, this is, let's say, root canal or a tooth that's severely decayed and abscess, anything like this. You got to remove all parts of the tooth. Probably 10% of what I do is remove the residual infected roots that got left behind that were hard to get. And I appreciate that. These things can be challenging, but you've got to get it all out. And you want to remove enough of that, whether it's gum tissue, whether it's, other type of soft tissue in the mouth, whether it's bone, so that all the stuff that has seeped out into the lymphatic system as much as you can safely. Okay. Then in our practice, we're using ozone to help disinfect the area.
And what is that for someone that doesn't know in a
Yeah,
simplified
great.
way?
Yeah. So think about like a gaseous form of hydrogen peroxide. We all understand, like, you pour hydrogen peroxide on a wound, or in our practice, we are ozonating water, putting ozone gas, which is medical grade oxygen that's been put through a chamber where it's like a miniature lightning storm inside this chamber. So, like, when it rains and there's lightning and you smell that ozone smell in the air, that's what we're creating, like, in a controlled fashion.
And why don't traditional dentists do that?
Well, they probably never heard of it. Yeah, it wasn't in dental school. We didn't talk about ozone in dental school. A big factor is the term that people can look up is called LPRF, leukocyte and platelet-rich fibrin. We're able to do blood draws, use a centrifuge to pull out the clotting factors and the immune cells of that human being, compress them so that we're getting rid of all the plasma, and just put the healing cells in that socket. Like, just like when you scrape your knee and it forms a scab. Imagine taking all those healing cells that your body already innately knows how to use and concentrating them. Imagine if that had happened with your wisdom tooth extraction sites, so that when they sutured it up, all you have is just a big party of healing cells in there that can heal this.
I had to go to a separate person for my wisdom teeth removal than my regular dentist. I remember that.
Yeah.
But you do all of it?
Right.
Okay.
Yeah. But, I've had extensive training in this in residency and surgery, and we've just keep growing the effectiveness and harnessing the body's own healing powers. How many dentists have a Novathor red light therapy bed in there? You know what I mean? But we know that amplifies mitochondrial function, which is what we want when we're asking your body to heal after an invasive dental procedure.
What aftercare do you recommend patients do at home for wisdom teeth healing?
Yeah, I would say same thing for any other tooth extraction. We send people home with homeopathics, 5 different types of homeopathic uh, pellets that they can use at home. Every patient that goes through surgery gets a take-home red and infrared light therapy unit.
Cool.
Yeah, it's theirs to keep. We also, and this is getting out there in the energy woo-woo, but it works, is we imprint into a liquid medium. So imagine we take all their infection and put it on what's called a remedy maker. This thing measures the electromagnetic frequency or the signature of that infection and inverts it into this liquid, which then they take home and put, drops of that in water and drink that 3 times a day.
I'm all in.
Yeah, it's awesome. It's awesome. And
now, people want to know, if you're holistic, does that mean that you're raw dogging all these dental procedures? There's no pain meds?
I would say probably 90% of our patients choose not to take pain medication. 90%. And it's part of our protocol to ask, like, have you gone through surgery before? Would you like to have this on hand in case?
But how do you cut into them for wisdom teeth? I don't understand.
Believe it or not, some people come out of that having had the source of aggravation or cellular disruption or energy disruption removed, and their body feels relief, particularly because we're harnessing the power of all their healing cells and
But
concentrating.
you're not numbing? You're not doing any mouth numbing or anything?
Oh, you got to numb it up. Absolutely.
Okay.
Yeah.
All right. That's what I'm wondering.
Even if they're asleep, which many of our patients choose to work with a dental anesthesiologist or a nurse anesthetist. They go to sleep. We're still numbing them because the body knows, even if you're asleep, it knows what hurts and what doesn't hurt. But as it relates to like narcotics, we don't prescribe a lot, but that's by patient choice.
Do holistic dentists still recommend braces?
In the right circumstance, yes. my feeling after watching people grow, and my own kids and their friends, my preference is if you can wait until your early to mid-20s, which is for a lot of people the point at which your skeleton is then finished growing, then you can move the teeth around predictably. The idea that we're gonna create this straight smile at 12 or worse yet, and this is what was happening a lot when I was a kid, you know what? There's a lot of crowding in here, keeping in mind their skeleton's small, and the teeth will always be the same size. Let's extract these set of premolars. You're not gonna need those. And then they compress the arch back, which leaves little room for the tongue, and then the airway gets compromised, so on and so forth. Um, or what if they have a tongue tie? They can't move their tongue around. How's the tongue supposed to like move like it's supposed to help form the arch as a baby who's hopefully breastfeeding?
Yeah.
Like
Let's talk about tongue
tongue
ties.
ties.
Do we have to get rid of those? We put them in a little mason jar on our nightstand? What are we doing?
Yeah. Ideally, that would be picked up just after birth. Like if the child's having a hard time latching, it's not just because 'cause they're like, well, they're a cantankerous little kid and, what a stinker this little baby. Like, look at what's going on. Are they in fact, is their tongue restricted in its movement? Um, we see it frequently. Again, I'm in adult practice, so we see it in adults. Matter of fact, just in my own team, in like maybe 3 weeks ago, I had a team member say, "Hey, I've had this tongue tie, my whole life, and I can't stick my tongue out, and there's areas of my mouth my tongue doesn't even go. I can't clean my teeth there." For those of us who have mobile tongues, we don't even think about that. And so we used a laser to just gently remove that, and you're releasing it more than cutting. You're not cutting something out, right?
Yeah.
I mean, there are cases where you might cut something out, but yeah, I mean, having a tongue that moves is helpful. It helps. I like the idea that your tongue, your lips, and your cheeks are God's orthodontist. Those are the things that were designed to help your arch form into the size that they were supposed to become in the first place. Um, I mean, orthodontists aren't gonna wanna hear that, you know? But I was just talking at lunch today actually about the idea watching we must have been someplace close to a school because I saw a lot of high schoolers coming into this restaurant, and I was observing the consistency of smile design, you know? Like like, socially, it's become a norm to have straight teeth. It hasn't always been that way. I mean, I remember TV shows and movies in the '70s and '80s where, you didn't think twice if somebody had crooked teeth. It was just normal, because that is the human experience. Some people have crooked teeth, some people have open gaps, some people have straight smiles.
How much do you hate the veneer obsession?
Yeah, yeah. I will say this, if you want a permanently wider smile and you love drinking coffee and tea, you might want to consider in my hands, a non-prepped veneer. Like you can make a veneer as thin as a contact lens and lay it over a tooth without grinding anything off the tooth. That's possible. I really, really, really didn't like the idea of veneers until I understood technologies were available to do that.
The typical veneer procedure where
Yes.
they are grinding your teeth into
Grinding your tooth
nubs,
out, yes.
is that causing problems in your body doing that?
It can, absolutely. I mean, one of the worst things I see that happens from it is, think about this. You've got a dental drill that's spinning at 200,000 RPMs, creating friction, and your nerve is 2 millimeters away. The number of times I see people who have cosmetic dentistry done that's aggressive, okay, just to be clear, not minimally invasive cosmetic dentistry, but heavy-handed dentistry, let's say, the nerves are screaming sometimes after that. And then, what do they go in and go, my tooth hurts now. Oh, you need a root canal. Oh, well, dentist said I need a root canal. I better go get a root canal. And now we're going down the path. It's like they never intended to, as a consequence of having a more beautiful smile, for them to end up with chronic headaches, metal sensitivity issues, quote unquote, autoimmune, or what they're now calling immune mediated health issues. um, that wasn't the path that they intended. And sadly, I mean, we usually meet the people after, right? Because I mean, we've treated people from around the country who had beautified smiles and then went bad.
I think everybody looks like they have piano keys in their mouth.
When it looks too good to be true, it's like, I don't know, is that that's one of the advantages of being in Portland and the granola-ishness and us, being weird or whatever, is that rarely do people come to me and say, "Hey, can I make them look like piano keys? I want it to look like a fake
Yeah.
denture."
You're gonna notice that being in Scottsdale, total
Yeah.
different vibes than you get in
Yeah.
Portland. Yeah,
And
a
I
lot
get
of
it.
that.
Different social norms. I do appreciate that, but I wanna make things look this is my personal preference in my profession, is to make things look awesomely real. I don't want people to go, "Oh, wow, I love your veneers." It's like, like, "Oh my gosh, I love your smile," is a very different compliment,
Yeah.
you know?
Can old dental fillings with mercury affect a woman while pregnant?
Yes.
How?
So, the vapor comes off, and this is affecting her from the day it goes into her mouth. The mercury vapor's coming off, you're inhaling it, goes into your lungs, it's absorbed just no different than smoking, you know? Goes into your lung, those cells absorb it, goes into your body, it loves the tissues of your brain. You can, go on YouTube and look up like how mercury affects nerves, University of Calgary. You can find some crazy cool videos from over 20 years ago where they showed what happens to brain cells when mercury attaches to these, little areas of developing nerves.
So
It's
if we know
fascinating.
this and it's been that long that we've known it, why is it legal to put that in a human being?
I cannot tell you. I know that the PAC money that's behind, keeping this okay, shall we say, is pretty significant. I mean, the American Dental Association's power is vast. Most dentists in America are members. I mean, I'm not. I gave it up years ago when I was like, look, I want to support the profession, but I also want to stand in truth. And we can't say we're about health when we're misleading people into believing that having mercury in your mouth is safe. It's not. So, the right time, again, I don't want to be dogmatic here, but I'm going to say the right time to start thinking about when should I get this mercury out of my mouth for the sake of my child would be before you get pregnant.
What can it be doing to the baby?
So it comes out through the breast milk. And from what I understand, working with, birthing specialists, naturopaths, functional nutritionists, the first child experiences a greater exposure of whatever toxins mom's been exposed to throughout her life as the body is, going into a very different state of existence, now trying to help this new human being come to life and sustain life and become healthy and,
So if you are somebody who's grown up, you're an adult, and
yes.
you're like, man, I have so many health issues that are unexplainable. If you know that your mom was somebody who had like tons of dental problems and mercury fillings, then maybe that could be like the woe of all of your problems.
And we've seen it. As a matter of fact, like I remember maybe 8 to 10 years ago talking with different healthcare providers about what I had observed in families. I'm like, I don't understand. Like the first child seems to have all these issues and the second and third don't. And then when they explain like what happens with a woman's body as they're developing breast milk and for the first child in particular, and how the body detoxes to make that happen, I was like, whoa, that's pretty interesting,
Yeah, that's fascinating.
Fascinating. So, like, wouldn't it be swell if before you get pregnant, you're thinking about those things? Now, oftentimes we get the phone calls like, okay, I'm weaning my, fifth child, and now I'm thinking about getting my mercury out. And it's like, well, it's never too late, of course, right? Never, never a wrong time to make the right decision. Um, but if whenever possible, you can detox your body prior to creating a new life, that would be awesome.
For somebody listening that definitely knows that they have mercury fillings,
Yeah.
how soon do they need to be making an appointment to get that out? I mean, are we talking like this week, or is like you've got as long as you go within the next 6 months, you're good?
Yeah, I would first suggest get on get on the internet and Google, search for a quote unquote smart SMART safe mercury amalgam removal technique certified provider. It's somebody who has, through the International Academy of Oral Medicine and Toxicology, gone through, jumped through the hoops, bought the technology. Let's hope they're practicing all the steps that are suggested in that protocol. Because when you're taking it out, you don't want to be swallowing it or inhaling it. You want to control where the outgoing mercury is going. You don't want it up your lungs, or and especially you think about my team members who get exposed to like potentially thousands of these per year.
Yeah,
We
how do
want to
you handle
control.
the dental professionals?
Yeah, so, I mean, we have a ridiculous looking suction device. I mean, it looks like, I don't know if you ever watched Sesame Street and Snuffleupagus and the big Snuffleupagus nose. It looks like that. This thing sits right in front of the patient's face, and it's pulling up like, I don't know, 300 and some odd cubic feet of air per minute, sitting right by their chin. So as that, there's going to be some vapor that's created, even though we're flushing it with water and all this suctioning everywhere. You want to capture that stuff coming out of there and direct it into a mercury filtration system. Just like we have mercury filtration in our outgoing water lines in our practices, wouldn't it be safer and smarter to also control the aerosols that are coming out of the patient's mouth?
Is it possible to reverse cavities?
Yes, with the caveat that there are many situations that it's like you're past the point of return. That tooth is, I mean, I've seen some miracles happen, I will say. I mean, honestly, patients ask me, "Well, what if I do this?" Like, "Okay, well, let's entertain it. I'm open to anything." But the breakdown on an X-ray, it'll always look broken down.
Yeah.
So that's gonna be information they'll want to understand. So we would, let's say we're seeing somebody and they live in Nashville and they're going back to Nashville to see their dentist after we've done the things that we're doing. And we say, just so you're aware, this is what this looked like. We're going to provide you with a copy of it. We want you to share this with your dentist so they understand what we're trying to accomplish here. Because otherwise, they're going to look at it and go, "Oh, big hole, time for a root canal and a build up in a crown. And that'll be 5 grand and some sickness." You know, it's it sadly, that's the standard for many practices where it's just look for the hole and drill it and fill it.
So somebody has a little baby cavity,
Yep,
and it really is that beginning stage, just like
yep,
it could be possible to reverse it. What things would you tell them to do to potentially reverse their cavity?
yeah. So I would first look at, why did it happen in the first place? Tell me about your diet, your nutrition, the frequency with which you eat. So it's how frequently we're ingesting is maybe even more important than what we're ingesting. If somebody's snacking on something that doesn't seem that, like a granola bar. I mean, I'm just gonna pick us up something out of the blue. Granola bar, but I have like one every couple hours because my blood sugar gets low at work and I want to snack. That's gonna present risk. So are you open to considering other foods if you like to snack more that might have a lower glycemic index? It's also gonna decrease your risk for diabetes, blah, 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 right? Just better for your health in general. So we would want to solve that because no product I give them is gonna beat out what they're doing on the daily, when they're during their waking hours.
What is the best non-toxic option for teeth whitening?
I have to say, I mean, I've seen people try a lot of things. The only thing I've seen actually effectively work is some form of peroxides, carbamide peroxide, hydrogen peroxide. What I've seen work most effectively long term is low concentration hydrogen peroxides. In our practice, and I mean, we've been doing teeth whitening for over 20 years. I mean, I can remember when we had like the laser whitening and this whitening system and all. And I'll tell you what, those high concentration whiteners, ooh, people don't like you very much when their teeth are giving them zingers left and right.
I've one time in my life tried to do the professional dental whitening thing.
Yes.
I have never experienced such excruciating pain. And after I got those zaps where it felt like somebody was stabbing me in the mouth, and
Yes.
I was like, never again will I do this.
Right.
So is that like, that's the thing, everybody's gonna experience that if you do any type of whitening, or is there something you offer that like doesn't do that?
So yeah, what we came across maybe 8 years ago, it's a system called Perio Protect. And the idea with this product on the front end was, this dentist was he's out of St. Louis, Missouri. He's trying to design a system of trays that would deliver hydrogen peroxide under the gum line to help his mom have less gum inflammation. Great idea. And he developed a wonderful product. And it's been very successful for our patients who have gum issues as well. Um, but it turns out when you have a like 1.2% hydrogen peroxide gel, I think maybe in 8 years of using these, I've seen one person have sensitivity. Most people use them daily, have no sensitivity at all, and their smile slowly gets wider and wider to whatever extent that goes, right? Now, if you're like, "Oh, this is awesome. I'm gonna be whitening my teeth once a day," but you also love 3 cups of coffee a day, I mean, pick your poison.
Are there any teeth whitening products
Yep.
at the store or online that somebody can just buy, like whitening strips or anything, any brands in particular that you're like, "This is a good one"?
Yeah, we keep some on hand actually at the office that are non-custom. It's like I think we get them from a company out of Colorado or something, and it's nice if somebody wants to boost, or you can use, and I mean, like, somebody like you who has a beautiful straight smile, like, you could put a Crest white strip, and again, I'm just picking that one because people are familiar with it. Because of the form of your smile, you could easily lay that over your teeth. It would have a positive impact in terms of brightening. Now, would it cause sensitivity based on what you experienced last time? Probably, and I mean, I've experienced that too. It is horrible.
Crest white strips, though, are those toxic?
The challenge with Crest white strips is you got it on your tooth, but how do you put it on your teeth because it's not custom, and it's also getting on your gums, and you're gonna absorb whatever's in it in your gums or your, mucosa in your mouth.
Is charcoal teeth whitening legit?
I have had some patients come in and who said they've used it, and they found it helpful. Whether I could appreciate that or not, I don't know. But I've had people say that even the oil pulling with coconut oil whiten their teeth. Um, Again, like, you'd have to how do you judge that? You know what I mean? Because somebody's gonna look at it in the mirror and go, "Oh, I love it," or "I didn't," it's subjective, I guess is my point. When they're at our office and we're using a shade guide, we're like, "Oh, okay, well, today you're A2," which is, a decent, nice looking shade for most adult humans. When they whiten, if they get to a B1, let's say, or something even brighter than a B1, that's like, "Ooh, that looks bright to us."
Yeah.
But at home, like, how are you gauging that?
How much of a game changer is tongue scraping?
All right. I love it. So, this is something my wife's super pumped up about.
I'm
The
so pumped up about
tongue
it.
scraper. She loves the metal
I
one.
broke up with a guy once because he said he didn't scrape his tongue. He had never heard of it, actually. He had no idea what I was talking about. I said, "We cannot be together."
I love it. Well, it's good because people, you swap spit. It happens. Like, you're gonna share microbiome. Um, yeah. I mean, we have a lot of patients. Matter of fact, that's also part of our home care kit is a tongue scraper for patients.
Why is this the biggest thing in, like, dental care right now?
I I like analogies that people get, and I'm old enough to remember the shag carpets. Like, my mom trained my brother and me to go around with the vacuum and, clean off the carpet. Why? Because stuff gets in there and you want to stir it up and, keep it clean. And it's a great way to keep it clean. It's not the only way to keep your tongue clean, but it is succinct. It's quick. It's easy. I will say for gaggers and, some of those people out there are like, "Oh, that's me." Uh, be cautious. Start easy. Start towards the front of the tongue, perhaps.
And when's the best time to use a tongue scraper?
My advice would be before bed.
Oh, at night?
Mhm.
Not first thing in the morning?
You could. I mean, you could use it in the morning as well.
That's when I'm doing it.
I just try to think of like, well, you might do it twice now. You never know. So think about you want to set the stage for like this time of calm. You've eaten stuff all day long, you've drank stuff all day long, whatever. Some people are smoking stuff all day long, whatever. And it's like, okay, we're gonna clean this up before your mouth gets a 6 hour, 7 hour, 8 hour, however many hours you're sleeping at night. Vacuum the carpets.
Mouth taping, scam, or absolute amazing new frontier in health and wellness?
I have seen massive benefits for a lot of people. Yeah.
I'm obsessed with this. Tell me everything. Why should we be taping our mouth at night?
It's not for everybody. I will tell you this, if you're claustrophobic, be careful. That it's or if you have jaw joint dysfunction, like people say, I have TMJ, temporomandibular joint, meaning I have problems with my teeth. be careful, right? Like locking things up with tape might cause some pain. So just, it's not, again, there's no one thing for everybody. But for those people where I've seen pretty significant impact, it's helping them get into a state of more nasal breathing, which ideally, apparently, that's how we're supposed to breathe. So if you're sitting there, think about like the open mouth breather at night, mouth's wide open. And, all these microbes that are supposed to be living in this nice bath of saliva, it's like the desert here. It starts drying up, and the nature of how it functions in your mouth changes. The tissues get more red, it's just not happy. So a little bit of mouth tape, people's tongues, hopefully are coming forward, up on the roof of the mouth, start breathing through the nose. Whether or not that, helps with snoring or anything else might be a different issue. Okay. For most people, better sleeping, better quality sleep. Most who tolerate it well, better energy, um, and better overall like oral microbiome. I know that's a big word, but like happier bugs in your mouth.
But it gets a thumbs up from you.
Yeah, absolutely.
Do frequent sinus infections have to do with teeth?
They certainly can, particularly root canals. So, and it goes both ways. So a sinus infection. Let's say somebody had a cold and something got in the sinus and it just gets inflamed. That inflammation is going to be sitting right directly on top of the nerves that go into the teeth. So if there's cellular activity and it's like, oh man, my tooth kind of hurts up in here. And believe me, I've seen this. It's shocking. Sometimes people go in and go, my tooth hurts. But the dentist doesn't have a 3D cone beam system, so they don't bother to take a cone beam. And they just go, oh, if your tooth hurts, you probably need a root canal. I mean, it's sad to say, but I've seen this more times than I can count. And usually what it looks like is you've had a root canal on your second molar, your first molar, and your second premolar. Those are all the three teeth that are adjacent to your sinus floor. Like, do you ever get sinus infection? Oh, yeah. I went through this phase, sinus infections. And, you know, but it can go the other way as well, where they've never had a sinus infection in their life, and maybe they have a big filling or, something happens with the tooth such that the tooth now hurts. Maybe a common one is, oh, you need a crown.
Do we really need crowns?
In my opinion, the vast majority of crowns are an over treatment of a tooth that could have used something smaller. Okay. I was actually at a class last fall here in Scottsdale. And the dentist, it was one of the best things I'd ever heard. He's like, I hate doing crowns. I think it's an atrocity to just blindly grind all the enamel off of a person's tooth because it's easy. It's very mechanical. And sadly, we got taught to do it very quickly in dental school. Like, the faster you do it, the more money you can make, that's the mentality. I'm thinking like, how do I preserve what's healthy? Because I want there is no crown, filling, anything I can put in the mouth that beats a perfectly healthy tooth. I mean, your own stuff is the best, right? So as soon as let's say you have a one surface mercury filling in your mouth, but because you've chewed on it for 20 years, there's some little black cracks in there, and you've never had a day of pain, by the way. Never hurt to chew in on it. It feels totally fine. Oh, we see cracks in your teeth. You need a crown. That's all they tell you. And then they do that nice little slide out, right? You're like, "Oh, okay. Oh, by the way, it'll only be $150 with your insurance or something," So you're like, "Okay, I'm in." And you come back in, they get you numb, and they grind not only to take the mercury filling out, hopefully they take it all out, but all the enamel comes off the tooth so you can do a crown. It's like you're re-enameling the tooth, but with something that's fake and with glue that doesn't stick that great. When you do that, the nerve it's absolutely possible because we see it every day. It raises its hand. It's like, ow, that really, really hurt. And so you go back in. My tooth hurts. It didn't hurt before. Oh, you need a root canal. There is a great lack of thoughtfulness. And I know that there are thousands of really conscientious providers out there. The trick is like, how do you find those people? And I think if you ask them, like, how often do you do crowns? I mean, my team will tell you pretty much the only time we do crowns is when we're taking off old crowns and we're putting on new crowns. You know, Like maybe getting the metal
So
out.
that's a good question. When you call the dentist's office, the holistic dentist, to see if they're legit, ask them, how often do you do crowns?
Yeah, because there are quote unquote biological dentists, holistic dentists where I live. That they're banging that drum. I'm a holistic dentist, and their patients come and see us after they've had treatment with, a mouthful of new crowns and their teeth hurt. It's like, well, let's take a look at what your teeth look like before you start it. And there's these tiny fillings in it. It's like, I get it. This is how we're trained in school, kind of see this, do that. Um, Unfortunately, it's costing people a lot of healthfulness. Because once you go down that path of root canals, like,
It's a cascade of interventions.
yeah, and we're not ever going to consider the root canal as a potential source of whole body disruption because we deemed it to be a necessary and appropriate treatment.
I constantly see photos of moms putting pictures of their like toddlers' teeth online, and they're like it's always crunchy moms. It's always people that are obsessed with non-toxic living. But these teeth are jacked. They're like spotted, brown, and they're like, "What's wrong? I'm using only non-toxic toothpaste and all this." And that is freaking me out. Even as a non-toxic person, I'm like, "What is that? Why do I keep seeing so many crunchy kids have these weird discolored brown looking teeth?"
You'd have to have an understanding of like what is their daily experience. Unless a mom can explain, well, okay, walk me through since birth, what has that child been eating and when? Like with what frequency? If they're sharing, whatever comes out in there, there's going to be a reason.
Because I'm just freaked out that it's something about the toothpaste. I'm freaked out that there's some ingredient or an ingredient we don't have in non-toxic toothpaste that we really need, and that's why it's causing that. But it wouldn't be that, you don't think?
I don't think so. I mean, I do see, like, I've talked to a woman recently where, she was saying she nursed her child until 5, which, I mean, that's what you do. That's what you do. I don't know. Um, but the child had a lot of, decay issues. And again, I don't treat kids, so we make referrals for that. But I want to ask, and it can be a very touchy subject because how we're feeding kids is it's a family decision. I think we enter into communication and relationship in a very non-judgmental way. I really don't care what you're doing. I just care that if you want your kid, by the time they're divorcing themselves from their baby teeth, to understand what a positive working relationship looks like with their adult teeth, something's got to change because if the system's the same thing's going to happen to their adult teeth.
Is it possible to get rid of a CPAP machine naturally?
Yes, for some people. I mean, I'm not going to step on a physician's toes. That's like, you got to use this forever. But if I were using a CPAP and I hated it, which I don't know the exact statistics, but I know the vast majority of people who try a CPAP are like, this sucks. Um, there are certain dentally provided therapies, one of which is called night lays, where you use 2 wavelengths of laser light to stimulate the soft tissues of the oropharynx. So basically behind the mouth, kind of where your nasal airway meets your oral airway. And you can tighten up those tissues. Um, it would depend on where's the constriction. If you're like trying to force air, I mean, my brain thinks of like, are you apneic because you had a lack of a CPAP? Like, is that how it developed? Oh, yeah, every human needs a CPAP. I mean, that's just silly, right? So I would want to look at what is it that's causing the breathing problem? Is it neurological? Is it a disrupted, um, parasympathetic and sympathetic state of balance from your energy? Like, I mean, it could be a lot of different things.
I saw this holistic dentist, and she posted about how she had a patient in like his mid-20s or something that had a CPAP machine that young, and that he was started on it as a teenager.
Well,
He was having all these troubles breathing or whatever. They put him on it, and then all these years later, things are getting worse. I don't remember what, but there's problems with his teeth. She looks into it. He has a dead tooth. He has a dead tooth that like got knocked in sports or something that had been like there was a whole infection brewing, and then that was what was causing his sleep problems,
sure.
breathing problems, but nobody ever knew, and they just said, we're just going to give you a CPAP machine and all this. And I was like, man, that's one of those examples when it comes to holistic dentists, like he finally went to go see a holistic dentist because nothing was working.
Yeah.
And then she thought to look into that, found that dead tooth, and now he breathes like a normal 20-something.
Yeah.
Should we be removing tonsils?
I have seen people where it's like, that's, here's an interesting one. People who get wisdom teeth out where it doesn't heal well, they develop these cavitations, let's say. The tonsils are doing work to clear that garbage as much as they possibly can and can harbor, the longer it's there, that they can be disrupted from a state of health where they don't serve you a purpose, and it could be wise to remove them. Now, obviously, you'd want to look at like, well, why are the tonsil's job is to raise its hand when something is creating it's not supposed to be there. It's creating an immune response. It's raising its hand for a reason. Could it be food sensitivities? Could it be something in the air in your home? I mean, you'd want to consider all the possible chronic exposure things. Um, Sometimes the person's airway is better off by removing them. Just depends. And I've seen both work. Like, let's look first at gut health. Let's look at food sensitivities. Let's look at, is there anything in your daily care practice that might be, you might be absorbing that could be inflaming that stuff? Are you gargling with who knows what at night? Like, I don't know. Could be a lot of things. Um, Put on the sleuth hat and start asking questions. There's no quick way to do that.
We talked about like the mouthwashes and how some are toxic. Are there certain dental flosses that you would never say that somebody should use because of how toxic they are?
I've heard a lot of people say, negative things about Glide floss, Teflon and all that. Usually the people who are like, well, I don't know, what else am I going to use because their teeth are so stinking tight, like to try to drag waxed floss through there.
How do you feel about cocoa floss?
It's a big hit in our practice.
I like it.
It's a big hit in my home as well.
It's cute. It's because of the colors. It's cute.
You have to admit there's something to be said for good merchandising and marketing.
Yeah.
They did a good job.
But you think it's a decent product?
Yeah. Oh, it's a great product. Yeah.
Okay. What is your body telling you if when you floss, it reeks like a dead animal?
It's going to mean that there is infection of some sort. The most common thing that people think of is like, oh, do I have gum disease? Some of the savvy people that I have met, they come in and they're like, I floss every place in my mouth. It doesn't smell like anything. When I floss around this crown, it stinks. Now, thankfully, I've been in dentistry long enough that I was a dentist before, all ceramic crowns existed. So when I got out of school, the only way you got a porcelain-looking tooth was to have metal underneath it. It was what it was. These days, the most popular material for crowns, because it is cheap and fast, is called zirconia. And biologically, it's not necessarily a bad material, but it's like insanely harder than your own natural enamel. It doesn't flex like a tooth, you know? And I've cut off hundreds, if not thousands of these things, um, where you peel it off and in the cement underneath it, it's just black, brown, pus laden, gross. And so when somebody says like, yeah, I smell this, it's like, it's got to go. How long you been noticing that? Oh, ever since maybe 6 months after they put the crown on.
So it's not normal for every single time you floss your gums to bleed?
No.
So you should floss no blood, nothing.
That's right. That would indicate health. So if you pushed on the base of your fingernail, if that bled and created discomfort, you'd be concerned. You'd know like, oh, yeah, I had a hangnail there. That's not normal. That's not healthy. I put some stuff on, it's healing. Okay, great. Same thing in the mouth. Like if you floss, it's bleeding. That's your gums telling you like we've got inflammation here. And we know that. I mean, if you have inflammation in your gums, it increases your risk for heart disease, strokes, Alzheimer's. I mean, this is like decades old science stuff. That's where things like these paraprotect trays, ozone, laser therapies, whatever is appropriate for that person, and maybe that person who's more prone to inflammation, let's say, for them, maybe seeing the dentist every 3 months might be more helpful.
Is there a connection between autoimmune disorders and gum disease?
Yes. Think about your inflamed gums as being a disrupted barrier to the body. You've heard of leaky gut syndrome? So think of this as leaky gum syndrome. Microbes that live in the mouth now have the ability every time you chew, pick at your teeth, floss, when you open those capillary beds, bugs go in. The body's immune system then says, "Hey, what the heck is this doing in here?" We're supposed to have integrity in our lining, outside, inside the mouth, all the way through the GI tract. So imagine, if you gently touch the inside of your cheek and it just immediately bled. You'd be like, "This is really concerning." But because it's so common for people to floss, a little pink in the sink, you know, we just like thought we don't think that much of it, or we just say, "Oh, like, well, then buy more of our, rinse, get more scope or something." And it's like, it could be a matter of there's some stuff that needs to be cleaned out. It could also be that your body's in massive stress.
Find out that I have an autoimmune disorder. Okay. Also find out at the exact same time I have severe inflammation in my gums. They want me to do a whole deep clean PRP thing. I have 4s, 5s, and 6s. So that is bad, right?
It's your body being inflamed, or your
Okay.
gums for sure.
Here's the thing. Also, I do this food allergy test
Yeah.
that tells me what foods are causing inflammation in my body or whatever.
Yep.
The 15 things that come up on this test are the foods that I eat every day.
Right.
My theory is that maybe it's not leaky gut where the food is getting in, going through holes in my stomach into my bloodstream and causing problems. Is it possible, and I was dying to ask you this, that the food I'm eating that's showing up in my bloodstream was escaping through the gum
Yeah.
pockets I have?
Studies show that. It translocates.
So then what I need to do is, now I did the whole deep clean thing.
Yeah.
They did the ozone, they did the laser, and should I wait a few months and then do that blood test again and see if it's still coming up? Like, how do I know if it is holes in my gut or if it's escaping through my gums into my bloodstream that's causing inflammation or showing up? And also, is this test fake?
Typically, that's gonna not always. I mean, it's usually gonna flag high for the foods to which you're exposed most frequently.
That's why I cannot. I'm like, is this real or not? I know this isn't dentistry, but
No, no, I mean, I've had experience with it both professionally and personally. I mean, I remember when I did this years ago, and I was like I was really high for lobster. I'm like, I couldn't tell you when the last time I had lobster was. It's not something we come by frequently at the Oregon coast, Um, but most of the things were like, oh yeah, I mean, that's like I eat that every day. Almonds. It was for me something I thought like, oh, okay, diversity would be good. But to your question about, is it possible that the gum inflammation that was going on could be leading to disrupted gut functioning? Absolutely. I mean, that's the functional nutritionist with whom I've worked a lot over the past 5 to 6 years. She's now out speaking to dental people, at dental meetings saying, "Hey, people, this is what I'm observing and working with me." And we're seeing and studies are showing that in fact, those same microbes that are in the mouth through the bloodstream when we get bleeding and flossing and all, and chewing as well, right? Because the tooth's moving around as it's getting beat up and pounding on food. Yeah, it's all connected.
the thing with autoimmune is that it's attacking some kind of infection in your body. And I found out that I have this gum inflammation. Could the gum inflammation have caused the autoimmune disorder if I've been struggling with this for years, or is autoimmune causing gum inflammation?
Yes and yes, like there's possibilities.
Okay.
You've shared something interesting, if we can, just reflect on what you shared about your wisdom tooth extraction site.
Mm-hmm.
There were issues enough so that you mentioned, like, there's a section of your nerve that clearly isn't fully functioning, right? So if there is an issue of chronic inflammation in that site, such that imagine if the pH of that area tends to consistently be lower than average, the way that it's gonna break down your own nerves, cells that, like, support around your nerve, will then as it breaks that down, your immune system is like, "What is all this broken down protein stuff in here that, we're not it's not supposed to be there. We need to respond to it." You know? So there's guy named Jerry Bucco, who's been doing studies for over 30 years looking at jawbone cavitation lesions. And, I heard him explain this about 2 years ago at a meeting, and I was like, wow. Like, because where's that connection? The body wasn't designed to reject itself. Why would it do that? And when you look at what are commonly done to millions of people every year, root canals, wisdom teeth, again, there could be other extractions too, right? But wisdom teeth are common. I mean, we literally have people call our practice and say, this blows my mind, by the way. My 18-year-old is due for their wisdom tooth extractions. Like it's something to check off on your list. Like get your driver's license.
That's what I was told.
Start voting. Oh, and get your wisdom teeth out. You know what I mean?
Who knows if I really needed it? I don't know.
Those things are all kind of on my curiosity list.
Being anti-corporation, crunchy, eating healthy, and into organic food used to be liberal virtues. Now conservatives agree on these points, and we're being labeled conspiracy theorists and extremists. Let's be honest about what's really going on here. The left is absolutely terrified of the inevitable loss of control that they will have over you and I if we stop eating their poison food, support local farmers and ranchers, stop their pills to help with the side effects of their poison food, and can actually think for ourselves. This is why Good Ranchers is so important. Good Ranchers is a meat subscription box company working with American farmers and ranchers in Middle America to give you meat you can trust. The majority of all the meat that you buy at grocery stores, even the fancy stores, is imported from countries other than the United States. You have no idea what is going into this meat. Right now, when you subscribe to Good Ranchers, you will get a free 10-pound Heritage Easter ham for free. For free. You will get a 10-pound Heritage Easter ham worth $118 completely free just in time for the holiday. Subscribe to any custom box with Good Ranchers that fits your family's lifestyle at goodranchers.com. Use code Clark. That code Clark will get you $25 off and a free 10-pound Heritage Easter ham. Goodranchers.com with code Clark. Find everything in the show notes. Good Ranchers. American meat delivered. How do you feel about elective permanent retainers? I got Invisalign. I wear my trays every single night, but I also asked to have a permanent retainer put in behind my bottom teeth because those are the ones that move the most very quickly, and I don't trust them, even though I am diligent about wearing my tray.
So I usually ask people a question. How would you feel if your teeth moved? Let's say they have one on. They're like, oh, I don't want it. But I've also asked them, like, how do you do with cheap earrings? You went to Claire's when you were young and you probably had oh man, my earlobe blew up. And they've got this wire with all sorts of, metallic elements in it that for some people's health is not going to be compatible with their body.
I got to do that dental test. I have to do the thing that tells me what materials I'm allergic to.
Yeah.
What if that is also causing some of these problems?
You weren't designed to have metals affixed to anything in your mouth. So, how do we decrease risk, but also maintain the stability of teeth? There is a way. And I just did it this week for a gal. She's had this same metal retainer for 20 years. She's like, I want the metals out because her health keeps going down. And she's like, I want bio, like biologically acceptable materials. So thankfully we have a laser that helps remove the bonding. So I don't have to cut into her teeth, get the composite off the teeth that are holding the metal in place, get the metal out. It also is nice because if you're not drilling on it, you're not going to release metal shavings in their mouth, right? So lasers are kind of cool. We then imagine using a very, very skinny uh, fiberglass mesh, much like you would use for a cast, like 2 millimeters wide on the tongue side of those teeth. And we're bonding the fiberglass mesh using composite, you know, and it just looks like tooth. Now you don't have metal in your mouth. The teeth cannot move. It's literally, you've put a maybe even more effective retainer than what we see with metal. Because I've seen people with metal retainers where, let's say they got placed at 16, the power of the jaw to move and grow is like nothing else. It's just, it's like it's going to do what it's going to do. And they're like, how is this possible? Like my teeth still went crooked and one of the ends popped off. And if people don't want movement, you have to retain somehow. But I think we should also think about okay, you went through well-intended orthodontics, straightened the teeth. Let's hope that everything, your teeth all fit together nicely. A lot of times after orthodontics, they don't. But let's say, oh, great, it feels wonderful. But the teeth then start to move. If they're starting to move, then inherently your body is saying, this is not where I find stability.
Some of us are destined to have crooked teeth, like we need that for our health.
The jaw would say it's more comfortable in going there for some reason. I don't know why.
And it could be giving us adverse health effects to try to force it to go somewhere it doesn't want to.
Right. So we could take the tongue-tied person. We've widened out the arches and this is all great. Then we take everything off, but their tongue lacks the ability to fill the space and be the retainer from the tongue side, right? So if that's the case, then things are just going to collapse and go back to where they started because the whole system wasn't considered. Braces are primarily, you know, influencing teeth and bone, not doing a whole lot around tongue management. I would say that over the last 25 years I've watched this, more and more dentists and orthodontists are becoming aware of and paying attention to things like you know, tongue movement function. Like you see more, at least in Portland, I've seen more and more myofunctional therapists.
Yeah, are those good? I got asked about that, if those were worth it.
Yeah, I mean, matter of fact, one of the hygienists who used to work for me years ago has pursued that as kind of a passion, in her line as a healthcare provider, as a licensed hygienist.
And that can help with mouth breathing and bad sleep and stuff as well, right?
Absolutely.
Okay.
Learning because it's one thing to release a tongue tie, but matter of fact, for the first tongue tie I ever released, I'll never forget the experience with this woman. We released the tongue tie. Now her tongue can move. There were muscles underneath her tongue that had never fired in her whole life. They physically couldn't move. And I said, go ahead and stick your tongue out. As soon as she did, all those muscles cramped, just,
She looked like Toast the dog. You know Toast the dog?
I don't know Toast the dog.
Famous dog on social media, and its tongue cannot stay in its mouth. It like hangs out. So she
I'll have to
experienced
look
that.
up Toast the dog. I think we covered a lot. I mean, the one thing you and I talked about before we went on the air is the nature, and this is like my passion, the nature of language. And I think that dentistry is a unique space where, granted, there are other branches of healthcare where people might feel uncomfortable, just because of I think of women going to the OBGYN, like that you're getting into spaces that are, private and all that. In the mouth, we're so getting into somebody's space. And when we use words that like need or should, and we're using the power of our professional opinion to tell you, we believe you need this or you should do this, I'm now putting onto you my belief system because of how I feel about interacting with other human beings. I want for your choices for your health to be about your goals. So when was the last time, you had a conversation with a dental professional where they asked, like, tell me about what the goals for your health are, long term, like when you're 50 years old, when you're 75 years old, tell me what the vision is for your health, your smile, as it relates to your whole body as well as, your oral health. I like to dig into that because I want to know, like, are the things that we're doing today going to help you get there or not?
Mhm.
So, and how can I help guide somebody to where they want to go if I don't ask? You know? So it becomes a different conversation than when we're understanding risks, dietary issues, home care habit, whatever, I don't want to say, well, you should drop the Coca-Cola. How about we base things on what someone's shared with us about their own goals for health?
So for somebody listening who has not gone to the dentist in years,
Yeah.
they've put it off, they hate the dentist, what is your elevator pitch in 1 minute or less to convince them that they should go to the dentist?
Yeah, I'd say you could not have found a better time in history to go see the dentist. Most, not all, but most are going to be more caring. I mean, in all fairness, we have more women in dentistry than ever before. The ability for dentists to listen more is probably better than it's ever been before. Um, there are technologies that didn't exist 20 years ago. And we just helped a woman this week who had severe gum disease. And I remember the first day I met her saying, like, it is such a blessing you waited until now to come see us because, a while back, 10 years ago, we wouldn't have had all this stuff that we can help you save your own teeth now. So, um, the way to ensure that that's going to be a successful journey is to accept what's happened and it's okay. Can't change the past. Um, and that there are loving, caring teams of human beings out there that want to be of service. It's going to take some work making some phone calls. People can always reach out to us. I mean, I help people, and my team and I should say, help people from around the world find providers that are loving and caring like we are. Some of them ultimately decide to come and see us, and that's wonderful. But we can't see, however many billions of people are on the planet, you know?
Well, that's the thing I was gonna ask you. Is there a database, like, you're like, "Go to this website, this will pull up all the dentists that would be people that, I would agree with in your area," because what's gonna happen after this interview
Yeah.
is you're gonna get 5,000 DMs of people
Yep.
saying, "I'm in San Antonio, I'm
Yep.
in Denver, I'm in Nashville, where do I go?" Where should they go to find a good holistic dentist?
So I'll give them some options because I believe in options and they can do their own work. They are, in fact, welcome to reach out to us, and we would be happy to help in any way that we can. Um, because what I would tell somebody is this is who I would see for this kind of care in this location. I have met hundreds of dentists across the country. I have wonderful relationships with dozens. And, I would only refer people to dentists I would see personally, or I would have seen my wife see, you know. Um, there are some groups, the IAOMT, International Academy of Oral Medicine and Toxicology. They've been around for over, gosh, probably coming up on 40 years ish now. Really started as a group against things like fluoride and mercury, and their database is awesome.
So if we put a link to that in the description of the show here,
Yep,
they can click on that and find a dentist?
yep.
Great.
IAOMT.org. Uh, the it's going to sound very similar. IABDM, International Academy of Biological Dentistry and Medicine. Another great group. Um, Most of the providers I know are members of both, but they have databases.
Do you take insurance? Do holistic dentists take insurance?
Some do. We do. I mean, we don't participate in any insurance plans. We help people with their form to get that sent off. So if they want to submit for reimbursement through their plan, they are more than welcome to do so if they have benefits. We will do what we can to help them get those benefits, but we don't participate in that. As you can imagine, most participating insurance companies are going to try to dictate to you the lowest common denominator, which looks like fluoride treatments and mercury fillings and root canals. And I'm not going to play in that sandbox.
And how much more is it to go to a holistic dentist, let's say, than a traditional dentist for just things like your 6-month cleanings and stuff? I mean, like, price difference.
As it relates to when we were providing those services, we didn't really charge people a lot more than we would have like maybe 20 years ago. I mean, because I was trying to be sensitive to offering good care, the best care that we could possibly provide to the greatest amount of people. My feeling is like if I've spent hundreds of hours and hundreds of thousands of dollars, if not millions, to buy technologies, get trained in certain things, and do all that, like I have to recoup that. But everybody getting a cleaning doesn't necessarily need to pay for that.
Mhm.
You know, something in Portland I've seen, by the way, which is kind of cool, and I imagine, excuse me, we'll see more of this around the country if states allow it. There's now a practice in Portland that is focused only on cleanings. It's hygienist run, so it's just dental hygienists there. They don't have all the fancy equipment that I have. They don't have the lasers, the 3D scanners, the, printing machines and all that. They have dental chairs and cleaning things. So the cost for those services is much lower. And we've actually had a number of our patients for whom we used to do the cleanings go there and be really happy. So, I mean, again, you're gonna have to find what works for you. And I think is in terms of price, let's say you love this one practice. They just keep increasing their fees, and you're like, "I don't even care because I love them so much and I have a relationship there." There's probably an amount they could charge you, and you'd go, "Okay, I'm done with this." But, it's about relationship and finding out what fits into your budget. Um, but as far as us, you know, charging and other practices, I don't think they're making it up so much on the cleanings.
Are you taking new patients in Portland?
We absolutely are, um, to the tune of 6 new patients a week.
Wow.
Every Monday, we see 6 new patients. I have 2 team members whose pretty much their sole responsibility is communicating with the people who reach out to us, throughout the world, and, finding out for whom can we provide the greatest benefit. So sometimes we will have folks who reach out and they're like, "Man, I'd love to come and see," it's like 1 Mercury filling. And I'm in Tallahassee. I'm literally just making this up, right? But it's like, okay, well, you know, I know Dr. So and so who's an hour south of you, and that might be a better fit. So you don't have to spend time, money, all these resources to come out here when there's somebody who's got 5, abscessing root canals and 2 titanium implants. That's a lot more skill required to take that apart and put it together predictably. I mean, I know because it's taken me this long to do it. Um, so we're selective and we want to find people of a certain mindset. We want to work with people who take responsibility for their own health. I can't fix people. I can help remove roadblocks that prevent great health, but it's psychological, it's emotional, it's nutritional, it's energetic. Um, and as we mentioned, like, talking about PEMF units and light therapy, those help. But the body is gonna take it and do what it can do with it, right? It's their own inherent healing mechanisms that are gonna flick the switch,
Yeah.
and somebody who's in a mindset of, "I I have this or I am that. I am diabetic. I have gum disease." Okay, can you, like, is it gonna be something you're gonna own, or do we just talk about that, okay, you're experiencing something, it's not where your body wants to reside. What's in the way of its getting to health?
Tell us about the Toxic Tooth Tour.
Thank you for asking. It's a passion project. So, again, going back to my calling, you know, around 2019, so I'd been a dentist for 20 years at that point. I felt God calling me to go. I mean, what dentist does this, right? Like, I'm gonna book hotel rooms across the United States and go out to talk to people that wanna commiserate about oral health. They wanna talk about their root canals and mercury fillings and blah, blah, blah. So we started organizing it in the fall of 2019, and then, of course, early 2020, COVID hit, and it's just everything stopped. And in Oregon, it was really a negative experience. That's all I can say. Very couldn't do anything. 2021, I'm like, you know what? I feel this the spirit moving me to do this again. And so we picked 4 cities: Kansas City, LA, Dallas, and New York. And I went to those 4 cities and invited anybody who wanted to come for like $50 a person or something, to have real meaningful conversations about oral health. And I usually spend about an hour and a half to 2 hours sharing my experience, trying to consolidate 25 years of experience and truth as I understand it with people. And then I just open it up for questions. Like, we'll Q&A all day. I make the caveat, I can't give specific health advice to any one person when I'm not in my own state because I'm not licensed here. But this year we're going out to 8 different cities. We'll be in Nashville, and then we're hitting Austin, Texas, Chicago, Denver, and Boston. We finish, I think, on June 1st. So, and it's awesome. We've already gone to Miami. My wife went with me to the first 2. I have my fearless new patient coordinator, Heidi, with me on the next 2. It's so much fun to see people. I mean, imagine this in terms of energetics, creating a space where there is hope, there is almost a sense of like love and belief in health, and there's no dogma, and we're just accepting of whomever wants to come and have a conversation. I stick around until people are done or until they start, emptying out the conference room.
Yeah, that's
You
so nice.
Thank you for saying that. I mean, I truly After I did the one in Miami a month ago, I had forgotten what an energizing experience it is for me to meet people and watch the hope light up in their eyes.
And where can they get tickets to the Toxic Tooth Tour and also find you on social media, make an appointment at your practice, all that?
Absolutely. So with regards to reaching out to the team and making an appointment with the practice, my website's the best place, blodgettdentalcare.com. That's also probably the easiest place to find to get tickets or reserve tickets for the Toxic Tooth Tour. You pull up the website, the banner at the top pops up and says, "Hey, sign up for the tour," and just click on it. You can click on your city, get tickets there. And social media. I've got a big ask for your followers. I truly believe that I was born and meant to spread this message of truth and health. And on our Instagram channel, it seems to be where I've connected with the most people. If every person that hears this sends my, whatever you call it, your handle, um, out to 10 people that they know that they care about and they want to see them live out the best, healthiest life possible, like somebody that they would be crushed if they heard that they developed breast cancer from a root canal or, a heart attack from gum disease or something like that. Please pass this on to people. Share our handle so that we can spread this message because I'm positive. I mean, I feel it in my gut. It's going to be a grassroots thing where human beings finally say, okay, enough's enough. Like, whatever, what happened. We used Mercury for 200 years. Like, but let's be done with this. Let's move on to things like, instead of all these root canals, which is happening to the tune of 25 million a year in America. I mean, it's an insane amount of dead teeth. Um, what else can we do? You know, I think once the human population starts demanding for better, then dentists will become more inspired to pursue those solutions that help fit their goals.
Yeah. Thank you, Dr. Blodgett, for coming on the spillover.
It's my pleasure. Thank you for having me.
Okay, let me see your teeth. What do you think about that interview? Are you interested in finding a holistic dentist, or do you love the one that you have? Are you influenced to go to any dentist if you haven't been for several years? One thing that would be really cool and helpful, I think, for the audience, if one of you wants to start a thread in the Cute Conservatives Facebook group where you could share the city that you live in and the holistic dentist that you go to if you have one that you really like. The Facebook group is linked in the show notes if you're not already a member. Next week, I am bringing back one of my most popular guests ever to discuss her new book, which helps women build a better life, prioritizing their family over career. It's a how-to guide on life as a woman who knows that one day she wants to have a family or already has a family and a career, but currently needs help putting her family first and dialing back the career part. It's my first time to meet her in person, and both her and I have been really looking forward to having this interview in person this time. We were supposed to do it like a month ago, but I was really sick, and so we had to reschedule. So please consider being a financial donor to the show. We're produced by Turning Point USA, like I said earlier, a 501c3 nonprofit. Everything we do is based on donations from cute conservatives like you. Make a regular donation or a one-time tax-deductible donation at the link in the description. And if you can't, leave that 5-star review wherever you listen and subscribe to Real Alex Clark on YouTube. And consider making lifelong friends at the Young Women's Leadership Summit in San Antonio, June 7th through 9th. I'll see you here next Thursday night at 9 p.m. Pacific, midnight Eastern. I'm Alex Clark, and this is The Spillover. Love you, mean it, bye.
Let's play Who Wants to Be a Millionaire? Here we go.
Who are the 9 out of 10 dentists who always recommend?
I think they're kept in a cave in the American Dental Association.
Why are they always recommending? Are they made up?
Yep. I actually have a buddy whose email is Fifth Tooth Doc.
Like the fifth one in the commercial?
Exactly. Because he's pretty contrary. He's like, yeah, we're going to question things. And I'm like, God bless you. I love that.